Okay, our next topic, we have the regional ultrasound. This is for the different uses of probes. So the regional ultrasound, there is a discussion akong kuan siya, gi separate depends on the probes that we will be using or we are using. So first we have the endocavitary probe. Siya, ang kita yung marker. Okay, so you have the endocavitary probe. So diba, it is termed as an endocavitary probe because it is inserted towards the cavity. Like for example, TRS for the transrectal, but it is inserted through the rectum or the rectal cavity. And then we have the TVS, in which the probe will be inserted inside of the vaginal cavity. Okay, so that's an example of the uh, how the probe should be inserted towards the vaginal canal of the patient, since this part is the sensitive part of our of the transducer. So this part should be inserted towards the patient, towards the cavity of the patient. Okay, so the endocavitary probe, it is a curved linear array, na-mention na ito gahapon, curved linear array ultrasound, and has a field view of approximately 120 degrees. So kana siyang 120 degrees kani siya, no, kana ihang phase dara. Okay, so dili siya full nga 180 but rather 120 ra siya. That's why sa image nato dili siya tibuok monitor ato makita, di ba? Kaya di man siya 180. Ato ra makita sa monitor is almost nga ra siya nga image. So that is a 120 degrees niya nga view. It uses high frequency, and again, di ba, kung atong ibalik atong discussion yesterday, atong previous na itong mga days, high frequency, if magamit ta ana, ang iyang penetration would be shallow. Shallow penetration siya, kay high frequency man siya. And then it usually operates at 6.5 megahertz. So makabantay mo ito sa picture ganina, ito sa ultrasound nga machine, kung asabit na locate to siya nga kuan ba na dili siya padunit sa 1 but rather padulong siya diri sa 10, padulong siya sa 15. So naa siya sa mga 6.5 megahertz. So the main application for its is for transvaginal or transrectal. Di ba mo ginayahang main nga purpose. Other than this, pwede gyapon siya gamiton for cranial scan. Kaya di ba gamay man kay siya. Tapos the fontanelles of the babies is very small also. Kaya gamay ra man ang mga opening. So usually ingani ang gagamiton. But if they have the phased array nga mga transducer, katong gagmay gyud bitaw kay phases nga linear array, so they can also use that. But if wala ganito siya, kung walay available nga linear transducer nga mga small transducer lang, so they can also use the endocavitary. So first we have the TVS, transvaginal. So this is the vaginal canal of the patient in which the probe is inserted, and then the view is approximately 120 degrees. Yes, makita nato iyang uterus ni patient, makita nato pod ang iyang rectum if the probe should be positioned as such. And then also kita po sa nato ang iyang bladder. Okay, para dili kay na sila ka gina tagani. Dili sila ang structure of interest, but rather it's the uterus. Diba? Especially for patients, nga female patients experiencing PCOS or in general examination, if ever pregnant ang patient, kay since gamay pa man kayo ang embryo dira, so kailangan siya og ipaduol nato ang ato ang transducer towards the embryo. And if mudako na, diba? Kung mudako na yung mga uterus, kaya nidako na po ang fetus, then pwede na dito sa gawas mag-ultrasound na nasa transabdominal na siya. Okay, so the example image ba, 120 degrees ang iyang view. Na siya. And then this is the lining of the uterus. ni patient. Sorry. So kani siya nga portion diri is actually demonstrated as this. And then the endometrial lining niya is this white portion. So if ever na problem ana, the size can increase, no? Pag alabaw na if kanang hapit na dugon ang mga female na patients, so sometimes the endometrium can be thicker than usual. Okay? And then if ever na problem si patient sa iyahang sa iyahang uterus, like for example, cervicitis or na siya mga sexually transmitted na diseases, so that can also be diagnosed sa ultrasound. No, ang iyang laban ang iyang structure sa sulod kung what happened inside of the uterus. If normal pa ba yung structure o basig daghan na kay cystic formation or daghan nag pus accumulation inside no nga wala nang gawas sa iyang sa iyang cervix nga nagpabilin na dito sa iyang uterus. Okay? So that's why no kung mag-insert po ta og probe, of course dili man nato siya i-insert nga directly insert, dapat na siya protective covering dire. So it's not just that the probe will be inserted ng probe itself without any protection. Diba ato na siyang gina-cover with condom. Na dire sa Pilipinas ang pinaka common is condom, di ba? Insertan siya condom dire before siya i-insert siya. So, kanin sa mga pictures na to, wala tayo wala condom. So, insertan ni siya dire kung na-assign mo sa ultrasound section, di ba? Insertan na siya o condom diha para ma-cover na siya. Para, of course, di ba? From one patient to another, we can protect the patients and, of course, protect ourselves from the diseases that we can get from the patient, and of course avoid transfer of diseases from one patient to another. Okay, just imagine transrectal examination, tapos no condom will be placed sa imong transducer, tapos the next examination would be a transvaginal examination. So transfer of diseases is bacterial infection is very high. That's why we need to protect. And then we also have uterine polyps. Ma-demonstrate gihapon siya. For example, this is the polyp. These are polyps. If ever na polyps any parts sa imong uterus, and if ever na pod sa imong fallopian tubes, that can also be demonstrated kung pangitaon lay ayo ni radiologist. Okay? So kani siya, and almost solid nga di ba? Almost solid siyang formation. Unang puti kay hang appearance because of the high amount of signal sa gikan sa imong polyps. Okay? That's because of the muscular layer niya nga nagprotrude dira. Diba? Polyp is an in-pouching. Diba? Compare na to sa diverticulum, a polyp is an in-pouching rather than an out-pouching. Okay? Next, we have the obstetrics, or basically kini mga buros. No, obstetrics for the first trimester, or first trimester of gestation, or first trimester of pregnancy. Okay? So, there are important measures or measurements for the first trimester. I know kabalo mo ani kay during your OSOE, during your clinical nga rotation, and also if ever natay mga natay mas common dito sa OSOE nagaka-question gini siya na kanang what are the 4 parameters, what measurements should we get if ever napa sa first trimester ang pregnancy. So diba, we have the first is the location of the gestational sac, the size of the gestational sac. And we also have the CRL, or the crown rump length. And then we have the fetal heart rate. Na maskin ingani pa siya kagamay, di ba, na siya heart rate sa first trimester. Makita na gina siya, ma-demonstrate na gina siya. Then of course, the yolk sac. No, the yolk sac. Like for example, in this one, we have the gestational sac. We have also the yolk sac, and then the crown rump length is simply to measure. Measure niya kung sa kataas. Then of course, kung if this is a live image no makita man ninyo nga yung moving part, na siya yung moving part diri dapit nga area. That is the heart rate. But ginatunong din ang cursor dito. And once matunog ng cursor dito, pwede siya i-Doppler mode para madunggan nato ang iyahang motion or madunggan nato ang sound during the motion of the heart. Okay? So we have the same like hapon nga image. We have the gestational sac niya, the yolk sac of the patient, kini gestational sac, and then the fetal pole. Okay, so the fetal pole mo siya i-measure po sa kataas. So for the CRL, the crown rump length. Then heartbeat niya again diha ra gyapon dapit. Dira ra gyapon i-measure. Kung as tong moving apart, kung naka-observe na mo mga ultrasound examination for the first trimester ng pregnant patients. So, makita ito siya dito. Okay? So, we have here a positive sign of pregnancy. Kanay yolk sac, naay gestational sac, and then the embryo. And then we have here a false pregnancy in which naay gestational sac but there is no presence of the yolk sac and then the embryo. Okay, of course, baka ni man sila duha mo important. Now, the gestational sac is just the mura na siya sudlanan kibali ni yolk sac and then ni embryo. So, if walay sulod si gestational sac, that means there is no growing fetus. No, there is no growing baby inside of the mother's womb. The CRL, first, corresponds to the length of the embryo in millimeters. Measures from the crown to the rump of the embryo, or the distance from the top of the head to the rump of the embryo, or dito sa iyahang coccyx dapit. Diba? From the top of the head and then towards the coccyx dapit the patient. Diba? You have the fetus, iyang head niya, tapos iyahang ang iyahang body niya, the thoracic cavity, tapos the abdominal cavity, ang iyahang femur niya, and then you have the hand of the patient or the upper limb of the patient, ito sa taas yun. Naghawid siya sa iyahang head. Okay? So, and then the vertebral bodies of the patient, mga solid man na sila, so that's why puti kayo. They are hyperechoic because they transmit a lot of signal. So next we have the transrectal nga ultrasound. So very common sa mga actually both for female and male, di ba? Pwede na siya buhaton. For the male, ang very common examination is to check for the enlargement of the prostate, especially those patients nga experiencing incontinence. That means dili nila ma-hold ang ilahang mga urine nga discharge, or if ever gasigig ihi si patient. So that could be an indication yun ay prostate enlargement, or especially those male patient that is already above 50 years old. No, very common na gid na siya nga mag-enlarge ang prostate. So to check for the prostate, pwede mag transabdominal, but then the best is the transrectal in order to check for the size sa ato ang prostate. Siya. Okay. So next we have the linear probe. So as you can see in this probe, no, kung makita ba ninyo na siya, nailingin nga portion. Kani siya repeat nga portion na kani. Kani siya, it's the marker for the transducer, the ultrasound transducer. So this marker should always be on the right side of the patient. Okay, kung dito na siya mabutang sa left, so that means the image would be mirrored padsad. Okay, so if this part will be positioned on the right side of the patient, that means paabot sa imong monitor, the right side of the patient will be displayed on the left side of the monitor. So mura gyapon tagatan-aw bitaw radiograph. Okay, or any images na to when it comes to CT scan, MRI, We also have radiography and ultrasound. The left side of the sorry, this is the right side. The right side of the patient should always be on the left side of the viewer. And then this one should be the left side, diba? Para pagtanaw na to, mo ni siya ang iyahang left side nako ni siya, so dapat mo ni ang iyahang right side. Right side ako ni, so dapat diri dapit ang iyahang left side. Okay? So the linear uses high frequency, again, high frequency, shallow gihapon iyahang penetration. And then usually operates at medyo mas higher siya compared dito sa imuhang kuan. Sa imuhang endocavitary, 7.5 MHz. It is suitable for superficial structures because of its lesser penetration or the shallow penetration. Application niya mostly for thyroid, the breast, and then scrotal. Yung mo nang pinaka-common nga examinations nga pwede gamitan og kuan kining linear nga probe. So for the breast, very common for the female patients, labaw na sila yung ma-feel nga lump sa ilahang mga breast area o sa ilang mga armpit tapit. Diba? Since daghan kayog mga lymphatic vessels, if ever na enlargement, so they have to have that check. Okay? So kung if ever gani, below 35 years old pa sila, so ang pinaka-common nga recommendation by the physician is the breast ultrasound. Diba? Kung above 35 years old na gani ang female patient, then that's the time nga dito sila sa ionizing radiation or the mammography examination. Dili breast ultrasound but rather sa mammography nga section. Okay, so we have here an image. We have the skin of the patient. Okay. You have the skin of the patient, and then you have the normal nga breast tissue. So that means nadari mo transducer, nadari. And then you have a cystic formation. Remember cystic nga formation, di ba? Anechoic nga center. Siya, di ba? Echo-free nga center. And then naapo din siya slight enhancement sa ihang posterior portion. Ba medyo nag-increase ang signal pag abot sa posterior portion. Pero since this is a high frequency, dili kay siya makapenetrate og ayo, muna dili na pug kayo klaro ang images pag abot na diripit nga portion. Okay, another image, we have the image of a normal breast. We have the layers niya. Again, this is the skin of the patient nasa taas. Then we have the mammary nga layer, also demonstration of a fat nga layer, since fat contains contains a lot of fluid, diba? So that's why medyo black yung appearance. And then we have the retromammary layer, and then as you can observe in this portion, black na kaayo, no? That's because dana siya sa pinaka-posterior nga portion, so dili na kay paka-receive og signal because of the, again, high frequency, shallow iyahang penetration. And then one of the reasons why pod sad nga dili gina-recommend ang female patients who are lactating or kanang bag-o pa nanganak nga mga patients, diba? If they are still producing milk, then they are not supposedly to have an examination both for mammography and also for breast ultrasound, because the lactating breast can sometimes create kanang images that can be that can result to misdiagnosis. Okay, like for example, when you compare this to a normal breast, ganina, di ba? Ingana yung itsura, tapos when you have a lactating breast, sumura siya na ay mga irregularities. Like for example, in this area, irregular kaya siya nga mga formation kini. That is because of the milk niya sa sulod, di ba? Milk is fluid. That's why ingana og itsura. Okay, so that can result to a misdiagnosis. For example, wala kabalo si sonologist or si radiologist that the patient is lactating, so it can result to this type of image, and that can result to a misdiagnosis. So mahatagan ninhoon og sakit si patient. And then we have here a complex nga mass. Again, kung complex nga mass, combination siya sa imuhang solid and cystic. Kakabantay mo ani. This is the mass niya mo niyang wall na mga asterisk. And then this part is solid, and then this part is liquid or fluid. So that means the mass is a combination of fluid and solid. So that means it is a complex nga mass. Okay. So there's also a posterior enhancement nga artifact, no? And then refractive shadowing. Kuan man siya kanang combination man sa duha, di ba? Kung may tag refractive nga shadowing, most commonly seen in cystic. No, cystic ng mga tawag ni cystic masses, and also posterior enhancement, since naman siya fluid nga content, so most commonly it will result to enhancement sa iyang posterior portion, no, nag-increase ang signal because of the fluid content. Okay, so naay naay numbers, naay oras, diba? Remember the breast, pwede siya i-quadrant, pwede po siya i-clock na system. So we have here the 2 o'clock, so that means at 2 o'clock sa iyang breast. We also have here na mention sa 10 o'clock, so that means it's 10 o'clock ni breast. Okay, so we also have an example of another mass. No, that means this is a solid nga mass. No, kay if you remember the description of a solid nga mass, pag solid yan siya, ang iyang content is kining naay echoes from the inside, no, na siya internal nga echoes. And then also ang iyang border is dili well defined. Now, unlike cystic, nga murag mulingin gid og ayo imo ang cystic, this time dili kayo klaro iyang borders, dili siya well defined, so that means it is a solid nga mass formation. For example, a cancer, an invasive nga cancer. Okay, so we have the regions, murag gihapog sa ato ang abdomen. We have 4 regions, the 4 quadrants. Okay, so quadrants, that means 4, no, upat ka division. So we have here the general niya nga division is the quadrants. The right upper outer, kay since duha man ato ang breast, so it is divided into the inner tapos the outer nga portion. Okay, so we have the right upper outer quadrant, kay nasa dapit sa outside portion. Tapos we have the right upper inner quadrant because it is the right breast, tapos inner portion niya or inner quadrant niya sa taas. We also have the right lower outer quadrant and then the right lower inner quadrant. Then also true for the left side. And then pwede gihapon if ever localized gid kayo siya, pwede siya ibutang naa sa iyahang, for example, naa sa right upper quadrant at approximately 10 o'clock. So for example, kato ganina, di ba, na ay 10 o'clock, naapoy 2 o'clock. So that means dirito siya nga scan, that means dirito sila nga scan. Okay, so if sa left put to siya nga breast, so that means kani siya, kani siya. So dili sila parehas og kanang quadrant per me, di ba? Like for example, si number 2 dire na siya sa inner nga quadrant, while si number 2 dire na siya sa outer quadrant. Okay, so not always nga si number 2 is nasa inner, si number 2 or si number 3 is na permi sa outer quadrant. For example, diba? Number 3 is outer, number 3 is inner. Next, we have the thyroid scanning, the thyroid scan. Again, no preparation for the thyroid. Letter T, this is the trachea, TR. And then the letter T, these are your thyroids. And then letter C, this is the carotid. And then this is your isthmus, the one that connects both of your thyroid. You have your isthmus. Here's an example of the ultrasound image. We have a benign thyroid nodule. Okay, so we have here your thyroid. Siya, the repeat portion. Siya, this is the anterior neck niya. So pasakan na siya. Dapit ang skin ni patient. Kinayahang the skin of the patient. Siya, dapit nga portion. And then you have the halo sign. Sorry. Diba? Okay, so na ay mass diha. So that means na siya benign nga thyroid nodule. And as you can observe, when you compare this area, compare nimo sa whole of the thyroid, diba? Somewhat hyper-echoic ni siya diri nga region. Compare nimo sa imuhang thyroid that is, for example, kani sila nga regions diri, they are iso-echoic. They are homogeneous. Same sila og kuan. Same sila o grayscale. While the other one, the dapit nga portion, na siya part in which hyper-echoic siya. So that means naglahi siya color compared to the rest of the normal thyroid. Okay, like for example, kani diba, normal ni sila nga mga thyroids. Diba? So ilang echogenicity is just the same, no? Homogeneous sila. Halos parehas gid sila color tanan. While if ever na siya problem, it will result to either resulting to a hyper-echoic region or a hypoechoic nga region. Like for example, in this image, we have the thyroid, medyo na-enlarge lang sa nga image. We have the thyroid nga na-enlarge because diba, that is goiter, enlargement of the thyroid gland. Tapos na yung mga fluid collection. Bantay mo na fluid collection. That could be an indication that there's a problem with the thyroid. Kaya anong nanay fluid collection inside of the thyroid. So that is because of the inflammation or the enlargement sa ato ang thyroid. So again, that is goiter. And then ultrasound appearance may be similar to simple cyst with no internal echo. And then sharp, well visualized ng echogenic wall with posterior acoustic enhancement. Sometimes ato mga nodules, no, not just always nga katong hyper-echoic, but rather sometimes napod sila mga hypoechoic nga mga appearances, no? Almost similar to simple nga cyst. Na simple nga cyst, that means ang ihang content is fluid lang. Kung may complex nga cyst, mo din itong na combination, diba? Solid and then liquid nga mga kuan, nga mga parts. Okay? So simple cyst na with no internal echoes, that means unechoic. So kabantay mo, di ba? Unechoic. That means black. Black iyang color. There are no echoes. There are no ultrasound signal from this part of the thyroid because there is an abnormal formation. Okay, and then since naman siya fluid accumulation, na siya formation of cyst, so most commonly napod siya posterior nga enhancement. Siya ba na siya posterior acoustic enhancement. Dili siya shadowing, but rather enhancement. So again, kung may tag enhancement gani acoustic enhancement, dapat uniform gina sila. Nga na gani itsura, di ba? Kung may tag katong comet tail pod sa, dapat katong tapered. Paana siya. Okay. So next we have the scrotal examination or the testicular ultrasound examination. So of course, both of the testicles will be examined and they can be examined they will be examined separately in order to demonstrate the structures within the scrotum. Okay, so this is an example. You have the testis here, and in yellow nga line, na, and then the epididymis, and then napod tayo demonstration dere that this is a cranial scan. Tapos dere na siya nga part. That means this slice is from this part of the testicle. Okay. So last nato nga probe, we have the convex nga probe or the curvilinear nato nga probe. So same lang gihapon, di ba? Na siya marker. So that means that is directed to the right side of the patient. Okay, so it uses low frequency sound beam. So low frequency sound beam usually operates at 3.5 MHz and suitable for deep lying structures because it uses low frequency, so that means much deeper ang iyang penetration. So general niyang application, for example, abdominal scan, the pelvic scan, and then obstetric scan if ever if ever second through third trimester na si pregnant patient. So we have the obstetric second and third trimester. So pwede na nga ang gamiton ani is kani ato ang curvilinear nga probe, in which, diba, since the womb of the mother is already filled with amniotic fluid, so dili na po siya kailangan of preparation. Okay, so for the second trimester ultrasound, or the second trimester would refer to the period of 14 to 28 weeks of gestation. Now, pen. Okay, so the objectives of the second trimester ultrasound is to, number one, to check fetal presentation and the position of the fetus, to check cardiac activity, generally for fetal biometry, placental appearance and location, amniotic fluid assessment, and then basic fetal anatomy. So these are the main objectives niya. Why do we need to perform a second trimester na ultrasound or the third trimester na examination? Okay, so for the fetal biometry, diba, medyo familiar ni sinha because sige na gina-question. Okay, so we have the four parameters, the four fetal parameters. We have the biparietal, number one, the BPD, biparietal diameter. Second is the head circumference. Third is the abdominal circumference. And the number four is for the femoral length. So fetal biometry refers to the fetal age. Diba? That's why it is important that we need to get the LMP of the patient, and corresponds to the length of the gestation, or that's basically gestational age, while fetal size refer to the fetal weight. Okay, so diba, para ma-measure ni radiologist if ever the baby is growing normally according to its age, and if the size of the baby or the weight of the baby is would correspond to the normal growth of the age pod sad niya. Okay, so 4 fetal biometric measurements are required for dating and or estimating fetal weight, which includes first the biparietal diameter, second is the head circumference, number 3 the abdominal circumference, and the number 4 is the femoral length. Okay, so if ever mag-transabdominal ta sa patient tapos naapa siya sa iyang first trimester, so dili siya maklaro, no, kay dili kayo makita kibali ang mga structures if mag-transabdominal ta. So that's why we need to have the first trimester if ever pregnancy patient dito gid sa sulod sa iyang vaginal cavity, kay nga naman the structure is still very small, no? Gamay pa kayo ang embryo ni patient. And if ever dako na, no, dako na ang fetus, and that's time nga pwede na kita mag-perform og katong transabdominal. So that's why gina-perform siya during the second or the third trimester kay dako naman ang fetus ana. Okay, so we have here the biparietal diameter. Okay, mo man ni iyahang kuan, iyahang parietal bones. So biparietal diameter. So basically pila measurement ana. So di ba kung tan-awon ninyo ang annotations pud sa monitor, like for example in this one, maklaro ninyo kung pilang yahang gestational age according to BPD. Diba? So naay kuandre 23 weeks 6 days siya according sa yahang kuan, according sa BPD. And then napod siya weight pod sa niya. So diba kung makabantay mo kung for example kanang if this is a live nato nga ultrasound na naay LMP niya tapos pila supposedly ang iyahang age karon according to LMP, naputay age niya according to the different measurements. Diba? For example, start first with BPD, pila kaha siya diri, muko inside baka siya dito sa LMP or dili. And then we also have the head circumference. Kani, no, the whole of the head ni patient. And then naapod siya measurement niya, di ba? Head circumference niya, tapos pila ang yang approximate nga gestational age. Okay? So maglain-lain sila pero at least dapat duol lagi na sila dito sa LMP. So ba diha pud gina-measure kung kano sa ang due date pud sad ni patient. Okay, so that's why di ba kung mag-ingon og due date ang radiologist, usually it's 1 week or 2 weeks ahead or before sa actual nga due date ni patient. And then we also have the abdominal circumference. It's basically the abdomen of the patient. Ang iyang circumference ang gina-measure. Then also, the height of the patient can also be measured with the femoral length nga measurement. So next examination, we have the chest of the patient. So again, if ever na ay chest nga ultrasound examination, that means there's a problem with the pleural cavity ni patient. So most commonly, di ba muna siya pinaka-problem yun. And if ever na ganito ay ingani na chest examination, dapat pangitaon na to ang yahang chest nga radiograph. Diba? The chest radiograph. In order for the radiologist or sonologist to check if ever asa dapit ang level sa iyang pleural effusion. Okay? Pleural effusion. Okay, so if ever diri lugar, kani lugar dapit nga area ang kanang fluid niya nga content. So pwede nga diri dapit magbangag dayon ang physician ni patient in order to insert the chest tube in order to drain the fluid from the pleural cavity ni patient. Okay, so this is an example of a chest ultrasound, and then diba katong requirement na to for the chest examination, chest ultrasound examination is to get or to acquire the chest radiograph of the patient. Like for example in this patient, so we have the chest radiograph of the patient in which naay demonstration of fluid content within the pleural cavity of the patient. So this is the part where the fluid collection is. So that means naay pleural effusion si patient. Pleural effusion. So that means there's a fluid collection within the pleural space of the patient. So if not a radiographic presentation of the chest of the patient, then when we examine the patient through ultrasound na modality, so that means we can focus on the left side of the patient, more particularly on the left lower lung field ni patient. So that means dito nag-collect ang fluid. So in order for the radiologist to focus his transducer towards the left lower portion, so dito po din sila maklaro nga na ay mga fluid collections. For example, no, kung asapit ang black na portions dire, that means wala sila ang naay mga fluid collection. Diba kani na dira, so that means na mga fluid collection dira. Okay. So another example we have here, the radiograph na medyo severe na iyahang kuan, iyahang fluid collection kay almost half of the left lung has already been collapsed. Wala na sulod nga hangin, so that means non-functional na. Okay. So sa iyahang pleural space, almost half ng pleural space is already filled with fluids. So that means we can insert, or the physician can insert the chest tube here in order to drain the fluid inside the pleural cavity. Okay, next we have the KUB prostate examination. For this examination, this is only done for the male patient. Okay, di ba naman si prostate? Kung KUB prostate, that is for the male, while KUB pelvis, that is for the female na patient. Okay, so you have the urinary bladder of the patient demonstrated with almost no echo or anechoic, and then also anechoic gihapon nga image of the bladder. And then you have here the prostate of the patient. Siya. Okay, so marag yapon siya og conventional radiography, di ba nga na siya AP and lateral in order to demonstrate the whole of the organ, both in AP and then the AP and the lateral projection. Diri sa yaha is the sagittal and then the axial niya nga views. Okay, so we have the urinary bladder, diba? KUB. Tapos sa dere. That means na cystitis na nag-inflame niyang urinary bladder ni patient. Okay, so nag-thicken. This is the normal layer unta. Nga na unta kanipis ang iyang wall, but then nag-thicken. So that is an indication that there's a problem, na inflammation, na thickening. So next image, these are the images of the kidney. These are images of a kidney. Kini siya na ay cystic formation. Makabantay mo dito sa head. Na ay cystic formation. Okay, so diba? The cyst, pag fluid ang content, is anechoic ang yahang center, or echo-free ang center. And then we have here another kidney with the glomerulonephritis, or the Bright's disease, in which if you look at the whole of the kidney, medyo na sila, no, medyo na homogeneous na tanan. Gamay na lang ang portion nga supposedly radiolucent, supposedly sonolucent siya nga or hypoechoic unta sila, di ba? This is the normal nimo nga kidney unta nga porma, in which ang iyahang borders is kanang mo sa iyahang wall bitaw padulong is supposedly hypoechoic compared to the central portion nga medyo hyperechoic. But with this problem na siya glomerulonephritis, that means nag-inflame ang iyahang cortex sa kidney, so munang nawala na ang katong mga hypoechoic nga regions. Okay, so in conventional x-ray, we have the stone, the staghorn nga calculi. Ba, dagpo kay nga stone, staghorn calculi. Also napud sa diri, napud sa stone that can also be demonstrated sa ato ang ultrasound. Diba, this is part of the liver, and then sa kidney dionia that is filled with stone. So yeah, may mga bright kayo nga mga structures, no, hyperechoic nga structures compared to the normal structure of the kidney. So supposedly ang central portion niya should be at the same unta nga homogeneity sa ato ang liver, but because of the stones nga na form dere, so na siya ang appearance became hyperechoic, no, taas kay siya echoes or signals. So next image is still of the kidneys. Okay, so this is kidney with hydronephrosis. Okay, so as you can observe, no, hypoechoic ni siya nga region diri, and also the center became also hypoechoic. Supposedly ang iyahang center is medyo hyperechoic compared to the cortex niya. Baka ni siya medyo normal ni siya nga image niya diri sa iyang outer portion kay dapat hypoechoic kina siya. And then in this image, in this patient, medyo nag-enlarge na, no, kang iyahang center, lagay na kay fluid collection. So that is a positive indication of hydronephrosis. And also in this portion, so that is not stone, that's actually hydronephrosis. So lahi ang stone, di ba, kay you can see the structure of the stone good. It's not just only the border but also and ring portions, like for example sa previous na tong image, kita nimo nga naay shadow gihapon, very bright shadow sa body of the stone. Okay, so still of the kidneys, same na gihapon. This is kidney with hydronephrosis. Okay, so diba nag-enlarge na ang iyahang pelvis, dapit nga portion, diba? Na enlargement na fill na with fluid or na fill na with urine, kaya ang urine dili na pass through towards the ureters and to be delivered towards the urinary bladders. Nag-collect sila dito sa iyahang pelvis. Medyo nibalik ito ang fluid towards the cortex. Muna halos nawala na ang iyahang wall, medyo nanipis na ang cortex sa kidney ni patient. And then last, we have the urinary bladder, in which naay stone, a very large stone. So this is the urinary bladder. Yes, siya. Tapos filled with fluid, that's why anechoic. And then we have stones, dayon, stone formation. Okay, so di ba na siya acoustic shadowing. Acoustic shadowing because of the stone. Tapos sa kilid niya na enhancement. That is because of the fluid. Okay. And then napaday isa. Okay. So this is an image of the kidney. Kidney na siya. That's actually a polycystic nga kidney. Daghan kay sa mga cyst formation. Ba PKD, polycystic kidney nga disease. Okay, so daghan kay sila mga cystic formations dara sa imong kidneys. So of course, that is destructive to the kidney, diba? Kay it can sometimes block off the passage of urine. Okay, so that's the last image, and that is the last discussion for the clinical ultrasound. So if you have any questions, message lang sa ako, then you can also comment put said sa classroom if ever you have any questions, clarifications, or if you have any concerns regarding the ultrasound lecture. Okay, so post-test will be posted later on after sa maybe by tomorrow, maybe by next week na siguro. Okay, so thank you all for listening, and thank you all for attending the ultrasound lecture. Okay, so that's it. Thank you and goodbye.